So very good afternoon, everybody, and all those of you, who have joined in. As a company, we have always been obsessed about care. I think that is something which has been close to our heart. If I speak to my people and all of us, and care is something that we try and see what can we do and how can we push the benchmark and what are very relevant that has to be spoken about, talked about, discussed about. So insurance, yes, that we do well. But more than insurance, if I look at the pandemic situation, and one thing which has been on the top of my mind for so many months now, and very early on I spoke about it, is that in the living human memory, we have never seen a crisis which has been so long. We have seen crises, we have seen earthquakes, we have seen tsunamis. It has been there, high impact, short time. Whatever has to happen has happened. Then people pick up and then they start rebuilding, resurgence, all that starts happening. In COVID, it has been for a very, very long time. Uncertainty, fear, sadness, from your normal routine, you're away from it. And I think I mentioned about 6-7 months that I'm not so much worried about the COVID pandemic and its impact, but I'm worried about the mental health issues that this pandemic will create of such a massive scale. As a world, as a society, as individual, are we prepared for it? Do we realize how do we slip into this? No? Do we realize that being very good, very healthy, being very happy with ourselves, how do we, in a constant environment of fear, of lurking doubts, how do we slip into this scenario and what we should do? So today for you, we have two experts, 2 billion people in this field, and from their own personal experiences, they have done so much and talked to so many people. We thought we'll have a conversation with them to see how we can bring this topic to the forefront. Because my worry in this is, let's say physically we fall ill, no? If we have even a small finger cut, or we have a migraine, or we have a headache, or we have some kind of palpitation, we rush to the doctor, we rush to experts, we ask for help, we talk to our friends, today this has happened. But when we start suffering mentally, initially small, we start hesitating. The stigma attached with it, somehow, I do not know why, has created such an issue that we wait before it becomes too late. Well, it does not require such kind of waiting there. And there's no shame in this. Each one of us, get me one individual who in his or her life has not gone through low phases. No, I'd be surprised. Each one of us goes through difficult times, good times, bad times, low times, sometimes low times for a long time. And then each one of us starts understanding how to cope with it. So what is the problem talking about it? And this is what we'll talk and discuss about it. And this is what we thought as a company we start bringing to the forefront of discussion. Because our belief is this pandemic is going not only to create the issue on COVID and economy, but an issue on mental health. And it's good that we start having conversation, understanding it much before it gets too late for each one of us. So I have for you Niloufer Ebrahim, co-founder and partner of www.emotionally.in. It's an online counseling, therapy and coaching, a consultant psychologist, psychotherapist at Jehangir Hospital, Pune, a corporate trainer and Posh advisor. So welcome, Niloufer. And we also have with us Nelson Moses. He's founder of Suicide Prevention Indian Foundation. And he founded that because his best friend committed suicide and he wanted to take action. A TEDx speaker, has been published in Mint, Fortune, Times of India, Business Standard. And you can see that on this subject, they are big experts. So I'll start with Niloufer first. Niloufer, you have had such a huge experience. Now you have set up a website in these times to try and help people as to what can be talked about or seen about it. Can you broadly speak about how did you start this? What has been your experiences? What have you felt, what you have seen? What is that one thing which surprises you even today on mental health issues when you as an expert are talking to people and looking forward to having a conversation with them? And what is that one thing you feel why people don't do it? Sometimes you feel like, why people don't do it? Like as an insurer, if you ask me, I get surprised why people don't insure themselves. I think that is something which is there. So what are these things and thoughts that you have in your mind, Niloufer? Over to you.
Thank you, Tapan. Yes, those are very interesting questions. Firstly, of course, when you said that this is a mental health pandemic, yes, that is what has actually driven a lot of people like me and Nelson also, who are people who worked in this field for a while. In my case, of course, more than 30 years. My whole team, I think we've collectively got individually we have 40 years of experience. We decided that if we do not step in now and do something about it quickly, there are going to be a lot of people with very little experience who are going to try and get onto this bandwagon, so to speak. It's a very scary scenario because I've called up some of the helplines and I've got frightening answers from them, just pretending to be a person in distress and so on. So we realized that we should also train people, give them experience so that they can do better, because this is not going to go away in a hurry. Unfortunately, you see, this is the thing with human memory. Of course, it's not in like my generation's memory. We did not see the Second World War. We did not see, plague and all of that. And whatever you talked about, like for example, when we talk about tsunamis and so on, they have happened in localized places. They're not taken over the entire world. They may have affected us in other places, but the tsunami happened there, earthquake happened there. So we kind of localize it, whereas this is very very generalized. It has not saved anybody, from presidents and prime ministers and royalty down to the poorest person. It has not differentiated between caste, religion, community. It has been a great equalizer, right? So we decided that let's get together and do this, and so that's how emotionally.in was set up. And it has been hugely successful in getting corporates and individuals to come forward and say, hey, can we talk? And that's the main thing. Can we talk? We don't talk. It's funny, we don't want to talk to a professional. I always used to feel that people can talk to their hairdresser while they're cutting their hair. We can talk to the dhobi, we can talk to anybody. But the minute we say, oh, you got a problem, you're stressed out, why don't you go talk to a counselor, a psychologist? Or, oh my god, I'm not crazy, nothing's wrong with me. So and Bollywood, I'm sorry to say, has also played a role in this word pagal, saying that you're crazy. There's a mental hospital where people are being given electric shocks and stuff. So we have, as a society, for thousands of years, we've talked to our own family members, we've talked to our relatives, we even talk to friends. Difference is that when I talk to a professional, or you talk to a professional like me, I come from a place of compassion, but I'm not coming from emotion. I'm not going to say, oh, my poor friend Tapan, look at what happened to him. No, I'm not going to do that. I am going to say, you are right. You are, maybe this is okay, maybe this is appropriate or inappropriate. I am not going to give advice either. Right? So, our approach towards mental health through COVID and post COVID, I don't think there's going to be a post COVID phase. I think it's just going to be a different flow from what's happening right now, with all the losses that we are going to have, financial, emotional, life, property. We are going to need help, and we are going to need help from people who have understood how to help you resolve your issues. I am not going to give you advice. I don't think my friend Nelson is going to give anybody advice. Our job is to help people find their strengths, use those strengths to be able to become even stronger and to be able to tackle their issues, because people like Nelson and me are not going to be hand holding them for the rest of their lives. So the stigma around talking about suicide, around talking about mental health, about talking about depression, anxiety, should go away. The brain is as much a part of the human body as your liver, your lungs, your kidney. If any of those things were not okay, you wouldn't talk to the dhobi about it. You would actually first try to treat it with your little turmeric milk and all that, and then you would actually go to a doc and say, hey, you know what, my throat is pumping. My mom committed suicide, and for me, as a daughter, as the daughter of the man who survived this scenario, I'm sure Nelson would be able to help out. I mean, the trauma is phenomenal. So that is one extreme. And we know, and Nelson will be really better, but we know that we are in a very, very dicey situation right now. So let's say, okay, let's accept the dicey situation. And what can we do about it to make it less dicey? That's how at emotionally and at Jehangir Hospital we look at it.
Great, Niloufer. I think the key takeaway is that talk. No, talk. Talk to professional, talk to experts. Don't hesitate, because that, I think, makes a huge difference. Now, from here, I go to Nelson. Your friend committed suicide, and that spurred you to get into this and see how can you help millions of people, and how can you save lives, and how can you go about doing it. So, how has your journey been, Nelson? How did you know? What were your experiences? Could you make a difference? What you set up doing it? What surprised you again in the whole process? What you think people should be doing, what they're not doing? What is so simply that has to be done, which can be done right now, which people would be avoiding, or not doing, and not thinking about it. So I want to hear from you, Nelson, your entire experience, of this journey of yours.
Right. Thank you, Tapan and Niloufer. Some very apt points that you made about it's easy to talk to your hairdresser, your doby about something like this, but it's difficult to go to a professional. You're absolutely right, and I must congratulate Bajaj Alliance for putting together this panel and this having this meaningful discussion. It's so relevant. We completely ignore mental health, and uh, we ignore it at our own peril. Um, so the pandemic has just actually opened up an opportunity. The pandemic has, for the first time, like I keep saying, mental health was brushed under the carpet, but now it's out, and it's literally like the shit is at the ceiling. Everybody knows because we are all in it together. Like Niloufer was mentioning, it's not sparing anyone. It's not locally contextualized. Whether you're rich or you're poor, whether you're in the US or you're in India, it's affecting everyone. Coming back to the questions you asked about saying, that my friend died by suicide, and why did I start it? Essentially, I guess this happened a long time back, and I just went on with my life without knowing how to respond to something like this, because mental health is not easy to understand. Like Niloufer mentioned, unless you are a professional, even to understand uh, and to provide any kind of help to somebody or to get involved in it is very difficult. So when my friend passed away, I guess I wouldn't have even known the difference between what is depression and what is anxiety. So time passed. At one point in time, I had a personal experience where I had a bad breakup. I went into therapy, and then I realized how effective therapy was, because I was carrying this weight of this problem and trying to talk to friends and family. But up until the time I actually went and met a professional, um, I couldn't get the help that I needed, because the professional made the difference about making things clear, about saying, this is what you're going through, and these are the steps that you need to do, and just help me to understand the problem better. In fact, I think the professional pointed out that the partner that I broke up with possibly had an undiagnosed severe mental illness. That put a lot of perspective, because earlier it was personal blame that I was attaching to this person, saying that the reason why this breakup happened, is because of maybe circumstances which could have been avoided. And then suddenly I saw this whole thing in a new light, because I remember this this therapist telling me that it's, from what you're describing to me, your partner seems to be having XXX, and I just came back and I said, yeah, absolutely right. So it gave me a window to say, oh, wow, mental health. And it also gave me a window to say that we don't need to suffer alone. We need to, there are many ways to deal with the issues that we have. And accessing mental health care when you have it available is one way to do it, right? So that journey then led me to say, okay, I'm actually interested in this and I want to do something in this area. Started off with a 40-hour course in listening and interpersonal communication. Then I realized this is something I want to do full time, and I did a 1-year course in basic skills in counseling. I did not get certified because of various reasons. However, what I realized was I went through the entire year. I was able to understand basic concepts of mental health. I was able to actually read up a lot about what is happening in India. And I realized that we are facing a situation which is pretty bad. So I said, okay, I'm not going to be a professional counselor, but I'm a trained journalist. So I want to write about it, because my main objective is impact. So I started to write about it, and luckily, a lot of mainstream publications picked up on this writing. And this led to me being commissioned to write an article on suicide prevention. And that's when I realized the magnitude of the problem we're facing in the country. So if you look at it, saying, according to the NIMHANS survey, about 200 million Indians in India, suffer from severe or common mental health disorders. We have about, according to, let's say, the National Crime Records Bureau, which the numbers are severely underreported. It's about the latest one for 2019 is about 1.39 lakh suicides. The WHO pegs this number at 2.15 lakh suicides. The Global Burden Disease Study pegs this at 2.3 lakh suicides. So while we have all of these issues that are going on, we also have the most number of suicides globally. So, and then I realized our response to this is actually very poor. We spend 0.06% of our healthcare budget on mental health. We have less than 40 to 45 suicide crisis helplines. Most of them are not, 24/7. Suicidality peaks between 12 a.m. and 4 a.m. in the morning, and there are hardly, I would say, 5 suicide crisis helplines that you can call. And like Niloufer was mentioning, because they are poorly funded, some of them, because they're over exhausted and burnt out, they may not exactly give you, the response that you want to hear. Some of them may not even pick up because, there are plenty of things happening. So I realized both in terms of our investment, in terms of our infrastructure, in terms of our personnel, we don't have a suicide prevention strategy in the country or a policy, that there is no required response to this. So that's why I said, if there's a point in time in your life where you want to stop talking the talk and start walking the talk, and I said, I guess this is something I want to do. So I set this up as a Section 8 not-for-profit in 2017 September, and I've been doing this full time. And initially, suicide prevention is a very hard topic to sell, because what we do is something really simple. 8 out of 10 people who are suicidal will give you verbal, non-verbal, or written signs. Picking up these signs and engaging with the person could help save the person's life in most cases. So this is called Gatekeeper Training. Gatekeeper Training is a WHO recommended suicide prevention strategy. So we have tied up with the world leader in suicide prevention, which is QPR Institute. We've trained 5 million gatekeepers globally so far, and we brought the training to India and started to train students. Started now, and then it was a hard sell initially because nobody wanted to. Sometimes they would say, "Why do you talk? Instead of suicide prevention, can you say stress relieving and so on?" Because it's easier to do, right? And just like you mentioned, it's a stigma. But I also want to mention that I've heard that at some point in time, mentioning the word cancer, people thought if you mention the word cancer that you would get cancer, right? And also the point is that at some point in time, HIV/AIDS, polio, leprosy, all of them have suffered the same kind of stigma. And it's because of these conversations like we're having today that, Niloufer was saying, we need to talk about it. More and more people started to talk about it. But now I've seen a big change that has happened since the COVID and the lockdown, is that, and especially I think the COVID, the lockdown, and what I would peg the Sushant Singh effect. This is because of the suspected suicide of Sushant Singh. There's been a conversation where suicide is being looked at as a public health crisis, right? So, so what have we done? We've been training those in manning crisis helplines because they are in the front line. So a lot of this is training mental health professionals, students, as well as now corporates have woken up to the fact that they're okay with having this conversation around suicide prevention. So we do workshops for corporates as well. So that's where we are at. And we produced a small piece of research where we actually surveyed therapists, and we found that, whether it's self-harm or suicide ideation, or those who have made a recovery, who are attending therapy and made a recovery, have gone back to therapy, a large percentage. And those who've never ever gone to therapy, which is what is the positive aspect of the pandemic, is both a curse and it's an opportunity to bring mental health front and center. So a lot of new people are joining therapy as well. On the flip side, caregivers, that is mental health professionals, are suffering from burnout fatigue and caregiver fatigue as well. So lots to be done, but luckily, thanks to this conversation going mainstream, I think we'll find that this is going to become a lot easier, because no longer are people saying, if I have an issue, then I will do this, because right now we are all in the same boat. I will say 90 to 95% of those who, of all of us have issues related to something or the other, which is affecting them in a very personal manner. And of course, the worst side of this, the ugly side of this, is suicide attempts and suicides, which have increased quite a bit. We'll only know these numbers sometime next year.
Thank you, Nelson. I think one thing which I realize is that since professionals are less, your endeavor in training students, healthcare workers in the front is big, because we have to have a multiplying effect. No, that I think clearly comes out
Yes.
from your conversation. Be
Yeah,
it corporates, be it students. So people actually do the front end bit, and they realize that where we have an issue and how to take it to the right discussion of place. And if I look at it, Niloufer, you are a corporate trainer, and you train so many corporates, and you have people working in organizations, and you have people who go through difficult phases. What do you think? A lot of us make very, how should I say, dangerous mistakes when we are talking to or handling a person going through a crisis, which you think is very common, but something that we can learn from or avoid, Niloufer?
So, Tapan, there are a couple of issues here. One, the first thing is to recognize. Now, let us say that I'm a team lead, okay, or I'm a manager. I have a team of people, and then I need to know, and this is what we do. We also train HR and so on, and also team leads and people at various managerial levels, how to pick up that somebody is disturbed. What are the signs that a person is not doing well? Because everybody doesn't come and tell. I mean, I might be looking down and you say, what happened to you? No, nothing. So, and but is my performance getting affected? Is my mood affected? Am I being more isolated? Am I not mixing? Or even if I'm sitting with my team or at lunch, in the break area, I'm silent and I'm not talking. Do I appear at work I had this one girl who used to, wear long sleeves. And it turned out that there was domestic abuse going on in the family where she was coming from. Nobody even knew about it. So those kind of things happen. There are people who are so overburdened by whatever's happening that they begin to act and speak in ways that they were normally not speaking. Right? They don't want to go home sometimes from work. Of course, right now we're all working from home. But it used to happen earlier where people didn't want to go home even after working hours. They continue to find things to do. So, firstly, people in management need to understand and appreciate the fact that people may be suffering but will not talk about it. How do we pick up the cues? Number one. Second thing is, when you come to know that somebody is depressed, somebody is low, or somebody comes home, somebody comes back to work, even in a virtual work, in a virtually co-located team, somebody is not well, they stay out of the team and then they come back into meetings and so on. The idea is to be extremely sensitive to what they've gone through. Whether they have gone through all the entire gamut, whether it's postnatal depression and it is anxiety and it is the fact is that they were not well emotionally, physically, and whatever happens to the mind affects the body. Where the mind goes, the body goes. For example, if you're extremely tired, you're likely to drop something that's in your hand. If you're extremely mentally tired, if you're physically tired, you forget things. So everything is linked. So when people are dealing with employees and co-workers, sensitivity is very important. You have to watch the person and not ask questions wherein, we're a very curious society. We want to know, oh, what happened? How are you? Is everything okay? Tell me now. No, I don't need to. I just need them to know that, hey, you know what? I'm here. I could tell Nelson if he's my co-worker. So Nelson, I'm here. If there's anything you need to talk to me about, buddy, I can maintain that confidentiality for you. Or can I come with you? Would you like to meet someone? That is the max I would do. I would not suddenly decide that I'm going to be Nelson's, friend, philosopher, and guide. That's not my job, right? So that's no, Nelson may not tell me. Sorry, Nelson, I'm using you as an example. Nelson may not even tell me anything. He may, no, Niloufer, I'm fine. But somewhere at the back of his head, he knows that here's a person who cared enough to ask, right? That's important. I remember when mom did what she did, people would ask my father such awkward questions. And dad used to be Commissioner Bombay and all of that. He was a big man, and suddenly he was reduced to being the husband of a woman who had killed us. Now, that is A, the ultimate rejection. B, how does society view this man? Suddenly the respect for him is gone. People began to, and he began to become very conscious. People are looking at me very oddly. People are looking at me in a very weird way. He left Bombay and moved to Pune. He couldn't face that city anymore, right? Imagine what people go through. What does a parent go through this child, commits suicide? And what does society do? Oh, something must have happened. Did you go to a doctor? Did you see? Now suddenly you want to ask whether they went to a doctor. All this time, where were you? When they come to know that, so things like, look at our marginalized communities. Okay, gay people who are suffering from mental health issues, people who have been traumatized by some incident in their own lives, or some people who have suffered domestic abuse. It is impossible to talk about these things in our society, right? So therefore, I think it's incumbent upon every one of us. Tapan, there are only 4,000 psychiatrists in the whole country. In a country of 1 point something billion people, 4,500 psychiatrists. So what do psychiatrists have the time to do? Write prescriptions? Where is the time? Where is the time to do a 50-minute hour, as we call it, of therapy, the kind that I do? Where is the time? And yet we need them because there are certain mental health issues that go beyond just counseling and therapy. If a person is severely depressed and is a threat to himself or to society at large, that person may need medication, right? So I think I have had very good support from the companies I work with. I've had places where somebody's been schizophrenic and the HR has come to me and said, okay, what do we do here? How do we help this person? Very good performer, but seems to think his food is being poisoned by his co-workers. I have had situations where somebody fell in love with another person of the same gender and attempted suicide repeatedly. And I got tremendous cooperation from the HR team. And confidentiality, another very important aspect. Confidentiality has to be maintained. It's the most sacred thing in mental health. Not because we don't want to talk about it, but because nobody has any business passing on my knowledge or my information outside. This is very sacred, scary information.
No, thank you, Niloufer. I think that's a very strong point. I think a lot of us from corporates who are listening to this is something we understand, that as corporates, we do business. That is our job, we do it. But on the empathy part, taking care of our people, figuring out somebody is going through some difficult times, how do we and how do we stand with that person? How do we provide assistance? How do we help the person go through difficult times? That to me is a big role that corporates, individuals as corporate workers have to deliver and perform. I think Niloufer has touched a very strong point here, and she given examples also, which I think goes a long way in showing how we can make a difference to our friends, to our co-workers, and how it goes about doing it. Nelson, on the difference to our friends, your friend went through trauma. Now, let's say if I reverse the time back, and with all your expertise now and knowledge now, what is something that you would want to share, that when we have friends around and if we find somebody going through trauma, how do we and what should we do in such circumstances? That's one. And the second question is that as individual, if we are going through some kind of huge mental stress or some kind of trauma in our mind, what should we do which should give us some kind of understanding on a very immediate basis? So these two questions for you, Nelson.
Okay, fantastic questions, Tapan. I want to answer them. Before that, I just want to say, Niloufer, thanks for sharing your story with Tapan and me and the audience. I'm really sorry for your loss. I know that I speak to a lot of survivors of suicide loss, and they are unable to process what went through, and some of them are stuck. Even after 20 years, they're actually stuck in the same moment. They don't move on at all. It's unbelievable.
For a long time, Nelson.
Yeah. So I'm really glad that you've turned your confusion or your grief or whatever, all are helping other people out. And I can't really imagine what your father must have gone through, because survivors of suicide loss, that happens quite often because nobody understands them, because essentially, like you said, up until that time, there may have been no attention given to you, but suddenly people and say, hey, this happened because of this, and because they don't understand it, and it's very difficult. So I'm glad that that you're able to process this. And if we are taking 2.3 lakh suicides, survivors of suicide loss, at least for every suicide, about 10 to 20 people are affected. So we're talking about 2.3 million to 4.6 million people every year who are going through unbelievable pain for every minute after this happens. In fact, they are at a high risk of suicide themselves, right? So yeah, we need to have a separate conversation about that, and I'm hoping that post this we'll connect and we'll talk more. Tapan, thanks for asking me those two questions. Number one is, what would I have done differently? Wow, it's such a it's such a loaded question, but I'm happy to answer it. And secondly, what can we do to help ourselves in case we're going through emotional distress? So what would I have done differently? So on that, 2 days before my friend actually died by suicide, he called me and he said that he's going through a lot of emotional pain and he needed help. And in fact, it was the second time we were having this conversation. And at that point in time, this happened 20 years back, actually, in 2000. And at that time, I only knew about this, NIMHANS, which is there in Bangalore, which is National Institute of Mental Health and Neurosciences. And I'd spoken to a friend who was working there, and he told me that the outpatient department was only open on a Saturday. This was way back, 20 years back. Of course, now, you can always go. When he called me, I didn't realize the gravity of the situation, right? When he said, so, but I should have picked up on all of the signs, right? Now as a gatekeeper, I will know that number one, he was unemployed. Number two, he was definitely feeling low. Number three, he certainly had perhaps a mental health related issue, whether it was related to depression, or there was a time when he told me that he was hearing voices. So we didn't have a diagnosis, but at least now I would have known that there is something wrong, and we need to immediately take him to a psychiatrist, because I will know that, hey, there are more than one suicide warning sign, therefore he is suicidal, and in fact he's asking for help, which means that he's reached a point where he's in the midst of making a decision, or he's already made the decision, but this is one last ditch effort to saying, if anybody can save me, this is the time, right? A lot of people will do that because everybody is at the end, essentially, suicide is wanting to end the pain or the problem they're going through. It is not the choice to end the person's life. And also, I want to point out that suicide right now is almost considered as a separate disease in itself. New research is suggesting it, which means that there are signs related to it, and there are symptoms, and it can be addressed, right? And we don't need to have any stigma associated to it. Just like right now, we don't have any stigma saying if somebody is diagnosed with cancer, or diagnosed with a mental illness, it should be the same thing, because it is not something which is our fault. It is not something that is our, because of the sins we, committed or whatever. It is something that happens to us. And just like it happens to us, earlier, because it's in the head, people will say, oh, we don't see it. But the fact is that people with with diagnosis of depression, if you take their MRI scans, you can actually see there's a difference between somebody who does not have a diagnosis of depression and somebody who does, right? So coming back to this about saying, what would I have done differently? I would have immediately gone to him, and I would have taken him physically to a hospital, so he would have got the proper care that he needs. Because suicidality is a very short-lived crisis. People are going through that very intense emotional pain for a short period of time, which because they can't bear it, they seek to end it, by ending their lives, because they can't bear the pain. So I would have taken him immediately. What are the signs of suicide? I'll quickly mention that if you're having trouble sleeping, if you are, looking agitated, like you're literally going to jump out of your own skin, and you're ruminating over the same thing over and over again. If you're verbally or non-verbally communicating that that you want to sleep and you don't want to wake up anymore, or you'll say things like, I'm a loser, I'm a burden, I'm in so much pain, I wish this pain would end. Then you'll start to give away your prized possessions. If you're older, you'll write your will. You there might be self-harming before that happens. Maybe you start to stockpile pills or other ways that you're going to do. So people will start to give out these signs where, there will be a difference in their physical appearance or the emotional appearance. There is a bit of even cognitive distortion where they may be a slurring of speech. There may be an increase in alcohol or drug abuse because they're trying to self-medicate the immense amount of pain that they're going through. But there is a lot of these signs that are available to you, right? They might be getting suddenly interested or disinterested in religion. There's talk of death. People who are earlier suffering from depression and were not talking, socially isolating yourself. Sometimes the opposite will happen, that especially after they go for treatment. Earlier, they may not have had the emotional energy to go through with it, but because now that they have got the treatment, or because they made the decision that I am going to die, they will suddenly appear very calm. They'll suddenly appear peaceful. They'll suddenly appear like they want to talk to you, and they will be different. So, there was an incident where I did a workshop in a college, and one of the women attending college had lost a friend, and she said that this particular friend never spoke to us, but 2 days before she died, she actually came and spoke to us, sat and had lunch with us, asked us how we were, and so on and so forth. So watch out for behavior where either people earlier they were talking to you, they stopped talking to you, or they were not talking to you and they come and talk to you and they ask you personal questions and so on. So there are a lot of signs that are there. How do you deal with something like this? Definitely I would urge everyone to do the gatekeeper training that we have. It's a 1-hour training that we have available. It's life-saving. It comes with a certificate. It's evidence-based, peer-reviewed and research-backed. Just visit www.spif.in and you can do the training. So what is it that you can do? And I'm going to give you a quick thing about what can you do if somebody comes to you and says, you notice that there are signs, right? First thing is just to be able to be there and to listen to them, right? Just because we've forgotten what it is like to listen. So you would say, hi, how's it going? What is happening with you? I'm here. Can you tell me what's going on, right? Just listening, and let them express themselves very freely. Let them talk about whatever it is that they're going through. Meanwhile, if they are telling you things which they may every now and then say, I want to kill myself, I want to kill myself, you've got to ask them about what is going on, right? Saying, what is happening? Why is it that you want to, have you decided to, die by suicide? Could you tell me little bit more? So they will start to explain. Sometimes just the action of explaining or is good enough for them, because it's a catharsis. They're talking about the way they're feeling, because it's the first time maybe that they can talk about this freely to somebody who's willing to listen. That can make a huge difference. Let it all come out. Meanwhile, don't interrupt. Just listen, but let them know you're listening. Let them know that saying, it looks like you're going through a really difficult time. I can see that you are in a lot of pain. And you can show this both verbally and non-verbally and in the tone of your voice. And allow them to speak freely, and then also communicate to them that you understand their current life situation. Because some of them will say, this happened to me, because this happened to me, I'm feeling this way. And because I'm feeling this way, I feel like there is no way out. Because they are feeling helpless, they're feeling hopeless, and they're feeling worthless. These are the 3 things that they're feeling, and they feel like there is no hope, there is no help, and I have no worth. They feel zero, right? And you'll be surprised. Sometimes like, I think a lot of times when celebrities die by suicide, that's when most people just suddenly wake up and they say, oh my God, this person was so good looking, this person was so famous, this person had so much more money, this person had so much success and everything was going for them. Why did this happen, right? So suicide is a complex problem. It's multifaceted, multidimensional. There are many reasons as to why it eventually happens. We only find out about the trigger, right? So what would you do if your friend is there? Just listen to them, and then let them know about saying that your life is important. I care about you. I want you to live, and also to get them to promise that they won't die by suicide until they get the help that they need, which is like a no suicide contract. Say, I care about you. Could you please let me help you, and could you please not harm yourself till the time that we get you the help? And then ideally physically take them to to a psychiatrist, to a clinic, to a hospital, and then make sure that you get their permission while you do it. So it doesn't, of course, under the Mental Health Care Act, you can, involuntarily hospitalize somebody if they're going to harm themselves or harm someone else. But involuntary hospitalization has, the research has proven that if you were to do that, maybe at that point in time, you can avoid a crisis, but you can increase the risk of crisis later. So that will be the last thing straw. But otherwise, that's what you would do. And of course, if you're not there in the same city, you would try and reach out to a friend, a neighbor, a family member, a colleague, and tell them to do this and put the person on suicide watch, just to be there physically up until the time that you can get help. Okay, what is it that you will do if you were to go through a crisis yourself? First of all, the realization should be that, hey, listen, for every suicide, there are 25 suicide attempts. Okay, and for every suicide, there are 100 people actively thinking about suicide. They're going through tremendous amount of pain, and the pain. So earlier, what happened before COVID and the lockdown and the pandemic? Earlier, what was happening at least was, if you were going through some pain, you had some help or the other, right? You were going to work, or you were going to some place for your spiritual needs. You were going to some place for your exercise, or you were meeting with friends and family, or you were taking off to nature. Now everything is within your house, and it's increased. So first of all, realizing that we're living in extraordinary circumstances, and there are going to be times almost every day where you're going to feel extremely low, and you will feel this sense, what I said, helplessness, hopelessness, worthlessness, and a sense of being trapped also, especially if you're, as Niloufer mentioned, you come from a marginalized family, or if you're stuck in a place where the abuse is happening at home, right? So to find a way to express yourself, to find some way to find help from a crisis helpline, a mental health professional, or sometimes you actually need a psychiatric evaluation so that a diagnosis can be done and treatment being given. And this is happening to whether you are, whether you're 14 or whether you're 70 plus. So anybody in between. So understanding that, number one, it's okay not to be okay, and the storm that you're currently facing will pass. And if you are feeling this almost all the time, to get help and ask for help from somebody that you trust, and get that help. Whether if it the most severe case is to be hospitalized for a little while, otherwise it's getting a psychiatric evaluation, and so that you can get medication, because essentially at some, it's literally like having a broken leg because your mind is broken, and sometimes you will need immediate surgery, you will need rehabilitation post that, and it takes a little time, right? So to be able to understand that you're going through this, and to say that, just like if I get COVID, I'm not going to say, oh, I've got COVID, what are people going to think? Or I've got COVID, why should I go to a hospital? You'll immediately, get yourself, first of all, there's a screening for COVID to say, oh, I have COVID. The same with mental health. And a lot of times we don't know what we have, because mental health, mental illness is only thought of as saying, oh, this person has depression or anxiety. But there are many other, there are personality and mood disorders which can affect every part of you. There's something called premenstrual dysphoric disorder, which can lead to suicide, right? So we have all kinds of conditions, and physical conditions can then, like Niloufer mentioned, lead to mental health related issues, which can then lead to you feeling suicidal. So there are many things, but primarily it's understanding that you're going through a crisis, and to say it's okay not to be okay. And when you reach a point where you feel that, hey, you're at a risk of harming yourself, to reach out to a helpline, or reach out to a friend or a family member or a neighbor, or go to there are many places where you don't necessarily have to go to a hospital. You can go to a clinic, and you can meet with a psychiatrist or a clinical psychologist, and they can really help you, almost, sometimes within a few days or weeks, that you start to feel better once you actually have a diagnosis and a proper treatment plan.
That was amazing, Nelson. I think you put in so much information and so much knowledge in such a short time. We're running short of time. In fact, we're over short time. So, Niloufer, any last comments from you, and then we sum it up for the day.
Couple of things. I think Nelson very nicely and very succinctly, in the amount of time that he had, pointed out what we need to do as individuals, both to help ourselves and to help other people. And Nelson, I feel every school teacher, every college professor needs to take your training. That's another source. So what happens also is the way our family structure is. What happens in our families is that we either talk about everything or we don't. The certain things we just shove under the carpet. We'll talk about how terrible my mother-in-law is and this and that, but we do not talk about the things that we really need to talk about. We do not prepare our young people to face the world. We protect them so much. Now, it is a job as a parent to protect your children. Yes, we are not going to throw our children to the wolves. That's why we gave birth to them. They are our responsibility, right? But what we also do is do not help them to become resilient. Do not help them to teach them how to think. We want to teach them what to think, right? A lot of the times we do not teach our children when they're at a crossroads in life how to take a decision. When I'm not there, I'm not going to be there for you all the time, right? So if our social structure has got to understand that we are wasting too much time on irrelevant things. I call them irrelevant. People may think that it's very, very important. But as a society, we're getting fractured as a society because of the differences that we have created. All our differences are man-made, unfortunately. And those differences have today created huge rifts in our society. So what has happened as a result of all this religious and caste and all the various differences that we have, regional, linguistic, and so on and so forth, we become extremely insular people. We think we're better than everybody else. How am I better than anybody else? What makes me better than anybody else? Nothing. You cut me and you have the same blood coming out of me. So therefore, people have got to understand that these things are now. I don't know. This change is not good. I would have loved to see it in my lifetime, right? But it ain't happening. My children's lifetime, I hope so. But we need to make our family structure. We love to say that Indians have a very strong family structure. Our culture is amazing. Excuse me, I don't think so. Our family structure is deteriorating. And not just because the joint family has broken up. The joint family was a blessing in its own way, and it may have had its pitfalls also. But there is child abuse happening, there is incest happening, there is molestation happening within families. There are children who are not being taught how to look after themselves. There are parents setting bad examples. The other day, a parent told me that he gave alcohol to his mentally retarded child and then filmed her dancing because she was enjoying herself so much. I'm like, hello, donkey, what's wrong with you? So what has happened to us? And I think this is what pains me the most. Today, when I see when people like Nelson who are working, this is amazing service, helping people to to prevent and to look out for those signs, those cries for help, and so on and so forth. Uh, my thing is, what are we doing at the family level? Are we building strong individuals? Are we building a strong society or a society that is weakening itself with cracks left, right, and center? Right? So we can't change the whole, as Joyce is saying just now, I can see her message there, lack of spiritual food. Our spirituality also, we are perpetually making a bargain with God. Hey, God, give me this, I'll give you Nariyal. You think God wants your coconuts? What's he going to do with coconuts? He made them. Right? So we as a society need to change. We need to create in a business culture. That's a society, that's a world of its own. Let's take Bajaj Allianz. You're a huge family, right? So you are an equal opportunity employer. You care for your people. You run programs which where you show caring. I think people come to work have to pick up these things and take them home. It's not something you leave behind at your desk or your workstation and go home and go back to lying in front of the TV and watching it and treating each other like, I don't know. Work from home has created its own problems also. If my husband and I knew each other when we were 25 years old, and now that at the age of 50, we suddenly see this person night and day in our face, we say, oh my God, who's this? This is the guy I married? I don't think so. And so today we are having more marital problems. I cannot tell you how much marriage counseling we are doing right now. How many people are just waiting to file for divorce, right? So I think we are not aping the West or anything. We're just falling down on our own faces. So we need to help ourselves. We need to be very strong individually. We need to make our children into strong individuals, and we need to learn. Parents need to learn what is parent. Who gave you the qualification to be a parent? Listen, are you a parent?
No, but I have a niece and a nephew, and very
Tapan,
close to them.
you have children?
Yeah. I have two
Neither
daughters.
you nor I, Tapan, neither you or I got a certificate from any institution saying you're fit to be a parent. Biologically, we were capable. Society expected us to tick that box, right? And we went ahead and we had our kids. What qualifications do we have? So I'm not saying we can go and get qualified, but surely we can learn to become more aware of ourselves, the speech, the way we talk to each other, to our partners, the kind of manners and mores and norms that we develop in our own homes, the kind of structure we have at home, that our children will learn to, grow up with, and not be, if the children see hammering, screaming, shouting, abuses at home, what do you think they're going to do with their own spouses or their girlfriends or boyfriends or whoever it is that they're out there, their team members, right? So I think this is what, when we talk about suicide, we look at that last awful situation, that absolute traumatic situation into which a person is driven. Who's driving that person? Is it only the devils in that person's mind, or is it also the social ethos from which that person comes? I think it's a combination of many things, as he very rightly pointed out. So we need to grow. And yes, thank you, Mr. Sharif. You say that human factor is almost missing. No, I beg to disagree. The human factor is there. Human beings seem to have regressed other than evolved. We have devolved. So I think we need to all grow up very quickly. And if COVID is going to help us grow up, let's use this as an opportunity in this
Thank you.
crisis.
Thank you, Niloufer. I think I've always mentioned this. In a crisis, we have a very simple decision to take, that we should emerge stronger. And every day when we get up, we should have this in our heart, and learn from it. And I think such beautiful points you have put forward, Niloufer. And I think it's such a pleasure talking to you, Nelson, Niloufer. It's been one of those amazing sessions where it was very personal to both of you. I think when I was listening to stories, and that's why I was listening so intently, it was very personal. It's coming from heart. Your experiences in life, your challenges you faced, how you not only overcome that, but how now you're using those opportunities that you're getting to make a difference to other people's life is something that really touches my heart. I think I felt so happy listening to those stories. And now the other point which comes through is that we have so few people who understand this. How you're trying to multiply it to have many more who can take the story forward. How do we create the funnel? And then as a society, how each one of us as individuals can make a huge difference. I think we should realize that. We should realize that we can make a difference. We will make a difference. We'll make a better society. We'll make a better country. We'll make a better world. I think that is why if we can think like this and do this, it'll become better for our children in times to come. And maybe, that is what is required today. Not the money, not the car, not the house that we're looking for, but a simple thought that how can we make a better place wherever we are. Now, thank you very much, Niloufer. Thank you very much, Nelson. And thank you for all those who joined in. Thank you very much. I think it has been a great session. I love listening to both of them. I have learned a lot. I'm sure you all are also learned a lot. Thank you. Thank you.
Thanks.
Thank you, Tapan. Thank you, Niloufer.
Pleasure.
Thank you.